بسم الله الرحمن الرحيم. نبدأ محاضرتنا اليوم هي آخر محاضرة في محاضرات النيك، والتي تشرح of the neck. حقيقة شرحنا كل ما يتعلق بال blood supply and the lymphatic drainage of the neck, and we can go to the innervation of the neck. We have the 9, 10, 11, 12 cranial nerve that supply the innervation of the neck, بالإضافة إلى sympathetic and parasympathetic nervous system. We start with the 9 cranial nerve is glossopharyngeal nerve. The glossopharyngeal nerve is a cranial nerve 9 contain afferent nerve fiber from tongue and pharynx, hence its name, and efferent fiber to the stylopharyngeus muscle as well as parasympathetic ganglionic secretomotor fiber to the parotid gland. It emerges from the brainstem medulla and passes through the jugular foramen, where it has superior jugular and inferior petrous ganglion, containing the cell body of afferent fiber. The nerve then passes between the internal jugular vein and the internal carotid artery and descends deep to stylohyoidopulses and muscles. The glossopharyngeal nerve curves anteriorly around the stylopharyngeus, runs deep to posterior border of the hyoglossus, and passes between the superior and the constrictor of the pharynx. This figure shows its origin of the cranial glossopharyngeal nerve that is from the medulla oblongata. The branching of glossopharyngeal nerve. The branches of glossopharyngeal nerve are, first, the tympanic nerve is secretomotor and vasodilator to the parotid gland. It enters the bone tympanic cancellus to reach the tympanic cavity, where it divides to form the tympanic plexus on the promontory on the medial wall of the middle ear. Having supplied the adjacent mucosa, the plexus forms the lesser petrosal nerve, which traverses the temporal bone, passes through or near the foramen ovale, then the synapse and the aortic ganglion. Both ganglionic secretomotor fiber arise there and reach the parotid gland by auriculotemporal nerve. Second branch, a communication branch joins the auricular branch of the vagus nerve. Third branch, the branch of the carotid sinus supplies the carotid sinus and the body with afferent fiber. Fourth branch, the pharyngeal branches unite on the middle constrictor with vagal and sympathetic branches. They are sensory to pharyngeal mucosa. Fifth branch, the motor branch to stylopharyngeus arise at the nostrils. And the sixth branch, tonsillar branch, are sensory to the mucosa of the tonsil. Seventh branch, the lingual branch, supplies taste and general sensory fiber to the posterior third of the tongue and the valet papillae. The ninth cranial nerve is tested by tactile sensation in the pharynx and sometimes by the taste on the posterior tongue. Touching the posterior wall of the oropharynx normally induces elevation of the palate and contraction of the pharyngeal constrictor as a gag reflex. After finishing the glossopharyngeal nerve, go to the other nerve is vagus nerve. The vagus nerve, cranial nerve 10, which is mostly afferent, is emergent in the head and neck, thorax, abdomen. It's both afferent and efferent to pharynx and larynx. It's the only nerves that supply the chest and the abdomen. It emerges from the brainstem medulla oblongata and passes through the jugular foramen, where it has superior jugular and inferior nodosal ganglion containing the cell body of the afferent fiber. The vagus is then joined by the internal branch of accessory nerve, the fiber of which are disrupted with the branching of the vagus. The vagus descends within the carotid sheath between the internal jugular vein and the internal and common carotid artery. The vagus then crosses anterior to the first part of subclavian artery. Its subsequent course is reserved with the thorax and abdomen. Its branches. The branches of the vagus nerve are first a meningeal branch, which contains spinal fibers, cervical nerve first, and second cervical nerve supplies the dura of the posterior cranial fossa. Second branch, the auricular branch passes through the temporal bone, tympanomastoid fissure, and supply the auricle and external acoustic meatus. Third branch, the pharyngeal branch, are chief motor nerve to the pharynx and soft palate, along with the glossopharyngeal and sympathetic nerve fibers. These branch from the pharyngeal plexus on the constrictor of the pharynx. The plexus supplies most of the mucosal muscle of the pharynx and soft palate. Axillary fiber in the vagus are tested by asking the subject to say "ah." The uvula should process backward in the median plane. Fourth branch, the superior laryngeal nerve, descend along the side of the pharynx and divide into internal and external branches. The internal laryngeal branch or nerve afferent from the mucosa of larynx superior to the vocal cord. Fold. The nerve pierces the thyroid membrane, divide into terminal branch, and communicate with the recurrent laryngeal nerve. The external laryngeal branch or nerve bears the inferior constrictor of the pharynx and enters the cricothyroid, supplying the both muscles. Fifth branch of vagus nerve is depressor nerve. Carotid branches assist the glossopharyngeal nerve in supplying the carotid sinus and the body. Sixth branch, the cardiac branch, lies in the neck and thorax and are often considered in superior, middle, and inferior group. They end in the cardiac plexus. Seventh branch is the main branch of the vagus nerve, the recurrent laryngeal nerve, supply the mucosa of larynx inferior to the vocal fold and all the intrinsic muscle of the larynx except the cricothyroid muscle. As a result of the embryologic development of the aortic arch, the right and left recurrent nerve arise at different levels. The right nerve hooking inferior to the first part of the subclavian artery and left nerve to the arch of aorta and the ligamentum anterosum. Both recurrent nerve ascend in or near the groove between the trachea and esophagus, and both are closely related to the thyroid gland and inferior thyroid artery. Therefore, they are dangerous in thyroid operation. The recurrent nerve gives off a cardiac, tracheal, and esophageal branches and a sensory branch to the laryngopharynx. It divides into two or more branches before passing deep to the lower border of the inferior constrictor of pharynx and beyond the cricothyroid joint to gain the larynx. Now, the other cranial nerve is accessory nerve. The accessory nerve, cranial nerve 11, arises by union of cranial nerve and spinal part. Then two parts from the cranial part and spinal part. The cranial root emerges from the medulla oblongata. The spinal root emerges from the spinal cord, sometimes as far inferior as the cervical segment, and from trunk that end in the vertebral canal passing through the foramen magnum. Both parts, the cranial and spinal, exit through jugular foramen. After traversing the jugular foramen, the cranial part or internal branch joins the vagus. It contains motor fiber to skeletal muscle and is best regarded as portion of vagus by means of the pharyngeal and laryngeal branches of vagus. It distributes to the soft palate constrictor of pharynx and larynx. The spinal part or external branch of the accessory nerve is distributed to the sternomastoid and trapezius muscles. It crosses the transverse process of the atlas ascent deep to stylar hyoid process and posterior belly of the gastric muscle and usually bears a sternocleidomastoid muscle which is supplied. At the middle of posterior border of sternocleidomastoid muscle, the accessory nerve crosses the posterior triangle of neck obliquely lying on the levator scapulae and in relation to lymph nodes. It passes deep to the anterior border of the trapezius and supplies the muscle. The nerve communicates with the second cervical nerve. The last cranial nerve is hypoglossal nerve. The hypocrisal nerve, the cranial nerve 12, is chiefly a motor nerve to the tongue. It emerges from the brain stem medulla oblongata and transverse the hypoglossal canal of the occipital bone. It then descends between the internal carotid artery and the internal jugular vein, deep to posterior belly of the gastric muscle. The hypoglossal nerve loops anteriorly around the occipital artery and across the internal carotid artery, external carotid artery, and lingual arteries. Its course lateral to the hyglossal and passes deep to the gastric and mylohyoid muscles. The preganglionic rami come from the first thoracic nerve, and postganglionic rami go to the cervical nerve 6 to 8 and to the first thoracic nerve. These fibers enter the brachial plexus and disturb to the upper limb. Other branch of ganglion go to the heart and to the subclavian and vertebral artery and the inferior cervical cardiac nerve. Where the vertebral plexus is ultimately disturbed along the basilar artery. The plexus on the posterior cerebral artery may be divided from vertebral or internal carotid plexus. Its branches. Most of branches of hyglossal nerve are hypoglossal in origin, where others are spinal and are merely travel with the hypoglossal nerve for the short distance. The first branch, meningeal branch, supply the dura of posterior cranial fossa. The second branch, the superior root of ansa cervicalis, descends from the hypoglossal nerve onto the ansa cervicalis and supply inferior hyoid muscles. The third branch, the thyroid branch, arises in the carotid triangle and supply the thyroid muscle. Fourth branch, the terminal lingual branch, supply the extrinsic except the peritoglossal and all intrinsic muscle of the tongue and communicate with the lingual nerve. Other nerve in the neck is the sympathetic trunk. It's covered by prevertebral fascia. The prevertebral fascia is split to enclose the sympathetic trunk, run behind the carotid sheath and in front of longus colli and longus capitis muscle. The sympathetic supply to the heart and neck arise in segmental spinal segment T1 and T2, and sometimes C8 of the spinal cord. The preganglionic fiber leave the ventral root and pass through rami communicate to the thoracic part of the sympathetic trunk. They then ascend to the cervical part of sympathetic trunk, where the synapse postganglionic fiber are disturbed to the blood vessel, a smooth muscle, and gland of the head and neck. The cervical part of sympathetic trunk consists of 3 or 4 ganglions connected by intervening cord or cords. The postganglionic fiber leave the trunk by gray rami communicate and also the branches that go directly to blood vessel or viscera. The cervical ganglia. The first cervical ganglia is the superior cervical ganglia lie inferior to the base of the skull. The transverse process of vertebral C2 to C2, C1 to C2, and posterior to the internal carotid artery and anterior to the longus capitis muscle. Is the sub postganglionic fiber to the cranial nerve 9 to 12 and cervical nerve 1 to 4, the carotid sinus and body, the pharyngeal plexus and larynx, and the heart. A plexus on the external carotid artery is continued on its branch to the cerebral gland. A large ascending branch from the ganglion, the internal carotid nerve, accompanies the internal carotid artery and forms a plexus that contribute to the several cranial nerves, the tympanic and greater petrosal nerve, the ciliary ganglion, and the anterior and middle cerebral arteries. The second ganglia is the middle cervical ganglia, lie at the level of the cricoid cartilage, vertebral C6, usually superior to the arch of inferior thyroid artery, is very variable. Give rise to middle cervical cardiac nerve, which is largest of three cervical sympathetic cardiac nerves. The third ganglion, the vertebral ganglion, generally lie anterior to the vertebral artery, inferior to the arch of inferior thyroid artery. The cords connect this ganglion with those above and below, and other cord, the ancestor previous, loops around and form plexus on the first part of the subclavian artery. The last ganglion, inferior cervical ganglion, the cervicothoracic stellate ganglion, comprise two variable loose components, inferior cervical and first thoracic ganglion. It lies posterior to the vertebral artery and anterior to the C7 transverse process and neck of the first rib. The cervical flexors. The ventral rami of cervical nerve first to 4 unite form the cervical flexors, while those of cervical nerve 5 to 8 and the first thoracic nerve form the brachial plexus. The cervical plexus is an irregular series of loops from which the branches arise. Cutaneous area and mucosal are thereby supplied by more than one spinal nerve. The cutaneous branch all emerge near the middle of the posterior border of the sternocleidomastoid muscle. The cervical plexus lie anterior to the levator scapulae and middle scalenus under cover of the internal jugular vein and sternocleidomastoid muscles. The ventral rami receive postganglionic rami communicate from the cervical sympathetic ganglion. The ansa cervicalis is looped on or in the carotid sheath. It is formed by fiber of cervical nerve first to 3 cervical nerve. It has superior root, which descends from the hypocrisal nerve, but consists of spinal fibers, and inferior root, which connects the ansa and cervical nerves 2 and 3. The ansa is superior root supply the infrahyoid muscle, but the thyroid receives its cervical fiber directly from the hypocrisal nerve. The phrenic nerve arises chiefly from C4 and supplies the diaphragm and the series of thoracic and abdomen. It often has a root from C3 and usually an accessory root from C5 that may reach the phrenic through the nerve to the subclavius. The phrenic nerve forms at the lateral border of anterior scalenus descent on the anterior surface of muscle under cover of internal jugular vein and the sternocleidomastoid muscle. It lies deep to the prevertebral fascia, is covered by the transverse cervical and suprascapular artery, as accompanied by the centric cervical artery from inferior thyroid artery. It passes through between the subclavian artery and vein, crosses the internal thoracic artery, and passes through the thorax. The other thing you can see in the root of the neck is copula of pleura. The copula is cervical plaque pleura. The example, the continuation of the costal and the mediastinal pleura over the apex of the lung. It begins at the inlet of the thorax along the sloping internal border of the strip. The copula and the apex of the lung project into root of neck up to 3 cm above the middle third of the clavicle. The copula is covered by fascia, the suprapalpebral membrane attached to the first rib and to 7 cervical vertebrae and first thoracic vertebrae. The muscle fibers, scalenus minimum, are sometimes present. The copula and apex of lung occupy the paramedial interval between the scalenus muscle and the longus colli, and are posterior to the subclavian vessel and the anterior scalenus muscle. Thank you for your listening to this last lecture.